Welcome to Public Health America. I'm your host, Dr. Wlliam Latimer. Here on Public Health America, we speak with experts from an array of specialties across the liberal arts and health professions to provide you with not only the best science, but practical tips to live a healthier life. We also celebrate what studies have long documented, namely the unparalleled value of a liberal arts college education by setting the stage to pursue a career of your choice, increase lifetime earnings, and engage in civil debate. Our experts will share decisions they made and support they received that helped them to beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. Wlliam Latimer. I'm here today with our guest, Dr. Sherry Maykrantz, Associate Professor of Public Health at Salisbury University. Sherry, welcome to the program.
Thank you for having me.
Really pleased to have you here. So I know you're doing some exciting work in international education and also on the critical importance of study abroad programs. Tell us a little bit about your work.
Okay, thank you. So I am a huge fan of global seminars, which are mini study abroad sessions for our students here at Salisbury University. They typically go for about 3 weeks in the winter or 5 weeks in the summer, and it really expands the students' learning experience, through this cultural lens of seeing other countries, meeting with other people, learning the different topics that we cover in the course, and recently just got back from a 3-week course in Austria, and that was fabulous. We do summer classes in Spain as well.
That's great. And so tell us a little bit about, let's do a deeper dive. What about international education and study abroad seems uniquely transformational at the undergraduate level?
Yeah, that's a great question. For one, it really pushes the students to step outside of their comfort zone. And I'm speaking because I've done this for 5 years, and I see every year students who've never been abroad. They've never been outside of the country. Some have never even been on a plane or left their home state. So it's really exciting to watch this independence and confidence grow within the student, that, they are not the same people when they come back after even 3 weeks. It's amazing. Their ability to navigate a country where they are not familiar with the language or maybe even the culture, and just do it with such confidence and excitement, is really also very exciting and very rewarding. And then, making new friends and making these new connections and networking is also really important. At that undergraduate level, we like to try and take them like their sophomore year so that they really can come back to the university and kind of be an ambassador for global health. Global seminars, and try to encourage more students to take part in it. And like I said in the beginning, I really like the shorter classes, because it's not so intimidating to where they have to commit to a whole semester.
Sure. Excellent. And tell us a little bit more about either your research area or your work as it pertains to international education.
Yeah, so I do a lot. I started a couple of years ago when I launched the trip to Portugal, because I was really looking at just the health policies in the United States regarding cannabis use. And at the time, it was not legal where we were. And so Portugal is really kind of the they were kind of like the founding country. So on decriminalization, and we kind of took that education and knowledge that we learned from them, and I would do some presentations there, kind of explaining to them, to people in Lisbon and some of the students at the university there about what the United States at the federal level looks like when it comes to cannabis policies and reform. And now that now we're legal here in Maryland. We looked at all kinds of other drugs too. We really looked into the use of opioids, and just kind of like looking at the two countries and what we can learn from each other was really exciting. And so, yeah, I mean, my research is really kind of broad. I look at everything from self-leadership and its impact on health outcomes at the individual level. And then I also look at health policy and population health management. So depends on kind of what's going on in the world and, at the local level as well. It kind of stirs my interest.
Sure. And so it sounds like internationally that looking at public health policy at a national or a regional level is something that's sort of helped to inform understanding and or policy change here in the States.
Yeah.
Are there other domains that you've focused on either in the US or through linkages internationally focusing on public health?
No, I just, pretty much stay within communications. We look at, how is our health being communicated? That's one of the courses I teach here is health communications. How are we taking our information and disseminating that out into the population? And I think it's really interesting, again, always looking back at what we're doing here and what are other countries doing. When we were in Austria, we learned quite a bit about the healthcare industry in Austria and specifically in the European Union. And it was really exciting to kind of have these organic conversations with healthcare professionals in different countries, and then to have the students to be such a big part of that conversation and felt really comfortable with asking questions and just kind of having that dialogue back and forth is just really beneficial, and that kind of sparks some more topics of interest and,
Sure.
and collaborating with professionals across the pond.
Sure. So, certainly healthcare and the funding of healthcare and access to healthcare has been a very significant topic and debate of the last 3 to 5 administrations and before as well. But what do you, when you go to places like Austria, Portugal, other countries, what are you seeing in terms of, is healthcare universal? Does it affect their tax base? What are the kinds of paradigms or decisions that you're seeing, particularly things that may make sense or benefit, just learning what works, even if U.S. doesn't adopt it? Maybe there are things we can learn from other countries. What would you suggest there?
Yeah, that's a great question. I'm just going to go ahead and kind of, since I was just in Austria, we were just talking about their healthcare and what the students really took away from it, and just what we as a whole took away from it is that it's so different from what we have here. Clearly, we have a combination, a little bit of everything, and in Austria they have a very clear, everything's free. It's through your taxes. The taxes are really high, but they're not really that high when you're looking at what you're getting for it. So, for example, everybody's covered there. You go to the hospital by an ambulance, you don't have an ambulance bill. You get an X-ray, you don't get a bill. Everything's covered within that. Now, if there's something that you want specific, maybe something elective, maybe something cosmetic, then that's going to be a little extra. And I think, I mean, I'm familiar with all of that. And I think what the students took from that was, wow, like, yeah, we might be paying 35% in taxes, but for that, we're getting so much more. And we don't have to struggle with, our parents maybe wouldn't have to struggle to pay for college because actually college is free there, just like their healthcare. So there's a lot of the oh, aha kind of moments where the students are like, oh, I didn't really know. I mean, I think as adults we understand how they work, but it's really important for this for the younger generation to understand how it all works, to maybe be an advocate for change that is serves our population best. Um, we are a much larger country, and I don't know that we could actually change in a way that other countries are doing it, but we can certainly learn from them and see what might work, and can we start leaning towards that more universal.
Sure. So we have a number also of study abroad programs at Chestnut Hill College in Philadelphia. And what we find sometimes, in addition to a lot of the great points you're making, is that when students come back from those trips, they not only have they learned so much from other cultures, but then they come back and they sort of see their own culture through a different lens. They, some of that can be sort of seeing sort of the link between another country and another culture, and historically, cultural and ethnic traditions that are here. What's your sense of that?
Oh, I would absolutely agree. I think they come back, the students come back much more hungry to learn more and to look, like you said, look at our country and our cultures with a different kind of view, a much deeper, richer. Um, there's more compassion. There's more patience. There's more intrigue. There's, I would say they come back more hungry, and eager to learn more and eager to experience more. So yeah, I think it's a wonderful opportunity that every student, in regardless of what college you're in, should absolutely look into.
Sounds great. We're going to take a quick break. When we return, Sherry Maykrantz, Dr. Sherry Maykrantz, will talk a little bit about her undergraduate experience and her education generally, and how it set her up for the excellent career that she has today. This is Public Health America. I'm your host, Dr. Wlliam Latimer. We'll be right back.
57% of New York City high school students are college ready by their senior year. "55% of high school graduates either have no plans to attend college or are uncertain that they will ever attend. "34% of young adults don't go to college because they can't afford it. Discover what's possible. BronxNet's education programs, internships, and opportunities help engage and inspire Bronx youth and beyond to pursue their passions. Be a part of the BronxNet family. Whether you're interested in our shows, joining a class, or donating to support our mission, visit bronxnet.org to learn more.
19.7% of Bronxites currently experience food insecurity. Meanwhile, instead of these nice, colorful foods, this is the best food that they have access to. If this sounds like you, there are a bunch of resources to get healthy food for free or cheap. If you want to help, you might consider donating or volunteering in one of these places. Community fridges like this one are all over the city, and allow New Yorkers to conveniently donate extra food to people who might need it. Go to this link and find your nearest one. Food banks and pop-up events like these provide millions of healthy meals to families in need. These organizations are distributing meals to Bronxites as we speak, and are always accepting donations and volunteers.
Welcome back to Public Health America. I'm your host, Dr. Wlliam Latimer. Sherry, we always start this part of the program with the same question, which is, tell us where you were born and about some of your formative experiences.
Okay. I was born in Maryland, and I was the youngest of four. My father was a physician. He was a doctor in OBGYN, which is delivering babies. And my mother was actually a nurse in the same area. So growing up, I grew up in a home that was very familiar with college and higher education and the professional track. I was a little, I'm going to be brutally honest. I wasn't the best of students. I wasn't a great student, and then I was a little on the wilder side. And I didn't get into trouble or anything, but I was easily distracted and just bounced all over the place. And by the time I got to high school, I was thinking a little bit about going to college, but I was more into like wanting to travel and I'll get back to it, or I'll get to it at some point. And so, my parents were very supportive, and I decided to take some time. I went to college, but it wasn't. I went like a semester, and I don't think I was quite ready. And took some time to travel and see the world, and I did things differently. And what I learned from that is very. So I got married and had children. And then when my children were younger, I realized that I really wanted to be a good role model for them. My husband had a college degree. I needed a college degree. So I decided to go back to school. What I learned from that now, looking back, I had a great experience. It was a little bit more challenging than it would have been had I gone to school right after high school. I definitely appreciated it a lot more, but within 12 years, I went through and raised a family and earned 4 degrees. And it was definitely challenging doing it that way.
No, that's a great story though. And Sherry, what's so great to hear is that, at a quote, traditional age, college didn't seem like the right fit for you. And so you did other things. And then later, slightly later in life, as a parent, you decided that that was right for you at that time. So I think what's so compelling and just nice about that story is there needs to be a fit. The developmental moment needs to work. And you very nicely sort of laid out when it might not have fit so well. And then later on, when it did, despite the fact that there might have been some challenges because you were balancing, raising a family and going to college, which isn't easy. And then you achieved 4 degrees, over a more than reasonable period of time. So that's a great story, very compelling. Where did you do your undergrad?
So I did my undergrad here at Salisbury University. It was close to where I lived. I was wanting to go to somewhere that was reasonable for me to. This was before online stuff. So I had to be able to get the kids to school, go to the university, take my classes, and come pick the kids back up. And the moment I stepped foot on Salisbury University's campus, it was, I knew that it was the perfect fit. Not like I had a really big choice because, where we're located is, at the Eastern Shore. So I'm not in a big city where I had a variety of other universities to choose from. But I think what was so much a part of my success was how well I was welcomed here, and being a non-traditional student, it was very intimidating, but it was perfect. So I did my undergraduate here in interdisciplinary studies, where I focused on health, psychology, and education. And then I went and I loved it so much, I just stayed on and did a master's degree here in education, which was a focus on college teaching, higher education. And that's really where I found my passion, my calling, some would say. And I just loved it. And so, again, I stayed on and went to the University of Maryland Eastern Shore, which is like about 15 minutes away from the Salisbury campus, and earned my Ph.D. And then after I earned my Ph.D., I didn't feel like I was well-rounded enough, or maybe I just didn't have enough on my plate. So then I went to University of Maryland College Park, and I went and got a master's in public health, just to kind of, broaden my knowledge a little bit more and really ground my discipline in public health.
That's great. So, I mean, even after your doctorate, you went on and did an MPH, Master's in Public Health at College Park. What was your concentration in?
Policy.
Policy. Okay. Health policy and management. Sure.
Yeah.
Makes sense.
Policy and practice actually is what it was. Policy and practice.
Policy and practice. Okay. And, as a non-traditional student, raising a family, what were some of the things that you found that were challenging? What were things that worked for you? What would the advice be that you would give to other, working parents or parents that are thinking about going back to college? What made it work? Because obviously you were very successful.
Yeah, I mean, I think for me, it was just that drive and determination. And I really, really wanted my children to be proud. And I couldn't really tell them that they needed to go to college without having my own degree. So I think that was really important to me. They were young when I started, so they don't really remember. The advice would be time management and really allowing yourself the time to be, the parent, and then be the student. And I think it just kind of comes naturally. My advice would be, it's never too late to go back. Had I wish I had done it the way my kids did it. I wish I had done it the way I was supposed to do it. I think that it would have been a different experience, but I also firmly believe that I'm on the path that I'm on now for the reason like that this is the path that I'm to be on, and every every moment in that I've experienced has kind of made me who I am today. So I'm not saying that I would go back and change it, but and I'm very blessed that I had that opportunity and all those learning experiences to kind of shape who I am today. The challenges are just you might not sleep as much, and you have to do a little bit extra. Um, but other than that, I think that eh, education is so powerful, and it doesn't matter what age you go and where you go. It's just if that's what you want and if that's what you feel that you should do, I think you should do it. And I think it's great.
Are you able to, with a minute or so left, are you able to utilize your own experience, going to college as a non-traditional age student with the work that you do now and/or the work you do with international programs?
Yeah, for sure. Uh, yeah, it's something that I constantly am aware of and I'm learning from and I'm talking about, and I think that it's made me a lot more open, and patient. Especially, we are starting to see more and more non-traditional students come back in. And when you look at some of my colleagues who are that traditional, they may not be as understanding as the students' needs, being non-traditional versus somebody who's living on campus and doesn't have the struggles of a family. Um, so yeah.
Excellent. Well, I want to thank Dr. Sherry Maykrantz for tuning in today and sharing about the importance of international education and traveling the globe and coming back and really diving into the college experience fully, and also sharing about her personal experience as a non-traditional age student and really finding college at the right time and the right place. I want to thank our viewers for tuning in. This is Public Health America. I'm your host, Dr. Wlliam Latimer. Until next time, take care.